Are you health literate? In other words, can you find reliable information to help you make decisions about your health? Our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here to discuss health literacy. And Doc, this all boils down to knowledge is power, right?
Knowledge is always power. And it's remarkable when we sort of think about healthcare. A lot of times people and my colleagues, right, we use all these big words like sarcoidosis or dyslipidemia. We need to be able to break it down. Patients need to be able to understand their health care and what their health care is driving to, especially around treatment.
So then what kind of problems can a lack of health literacy lead to?
Well, I think the first thing is what I sort of just described, right? When we as physicians use big words, the patients don't even know what they have. And I think that's one problem. The other thing is that when we think about what is health literacy, we need to allow patients that ability to find, understand, and use information to make the best decisions for themselves. If they don't have health literacy, it can affect how they get care, where they get care, the quality of care, the right type of care. There's a whole host of things that go with that, and that's why it's really important.
And it is important, too, to know where to turn to for reliable health information because Dr. Google isn't always your friend.
Yeah, there's a cup that goes around medical services that says, Google is not my medical degree. And it's a little bit flippant, but it is actually true. What you really want to do is be able to have a conversation. This lays it out really clearly. I always tell patients that there are no questions that are bad questions. Make a list. Prepare for a physician or a clinician visit the same way you would prepare for anything else, right? Make joint decisions with your physician. It shouldn't be, even though we hold physicians and clinicians in high regard, it shouldn't be them dictating to you. It should be shared decision making. I think that's really important. And if you don't understand it, just ask, right? I think that's the key. A lot of times patients leave, then they call the clinic a few days later, hey, I have no idea what was said. And I always feel bad because that means I have failed the patient.
And of course, too, at the same time, if you have questions to ask your doctor and they look kind of antsy, like they want to move on to the next patient, it's kind of like, wait, I still need to talk to you about some things.
Absolutely. Don't be afraid. I mean, that's your time. And even if your time goes over, you need to be able to walk out of there and feel comfortable that you've gotten the best answers and the best understanding of your current condition and the steps until your next visit or what's going to happen after that.
And we do have some resources for our viewers to show here where they can turn for reliable information.
Yeah, so I call it the ABCs, right? It's authority, bias, and current, right? So in as much as you may go to Google, that's fine, but go to reliable websites, whether it's the Mayo Clinic, whether it is Medscape, there's a host of things, government sites, gov.edu, those are all the places that you need to really go and look for that information, because the worst thing that can happen is if you don't understand your visit, you go online and you get scared and anxious by the host of data that's out there that's just, to tell the truth, Mark, plain wrong, right? That can't help you either today or tomorrow, and I think that's really important.
ABC 7 medical contributor Dr. Ogechika Alozie, as always, thank you.
Thank you, sir.